So in starting, what we want to do is make a disclaimer, essentially about the researchers involved in this project, as well as the environment in which we're working, because we do believe that that impacts very strongly on how we look at the literature, we look at the evidence, and look at the findings and interpret them. So who am I? I'm a physician. I'm a white male. I'm French-Canadian in origin. My family came from France over 350 years ago, and I was raised in a small town, and I identify as first-generation university student.
Kwe sego deluzi Paige Isaac ni na migmawaj Christovich Leary. Hi everyone, my name is Paige Isaac. I am Mi'kmaq from Listuguj, on the border of Quebec and New Brunswick. I studied at McGill. I did my Bachelor of Science there, and I'm also a first-generation university student.
And as somebody pointed out in another presentation that we did, her family arrived much earlier than my family.
And I'm the newest kid on the block. My family came to Canada in the 1950s from Italy, and I'm a first-generation university student. I'm also a psychologist.
So I'm the coordinator of the First People's House at McGill. We're a part of Student Services dedicated to supporting Indigenous students on campus, supporting their success and well-being in a culturally welcoming environment. And so just to give you a little bit, we do everything from outreach and advising to student support to celebrating students at their graduation and hiring part-time students to take care of some special projects that we have going on. Of our team.
So our story, for those of you who are not from North America, this started with our participation in McGill for the first time in the National College Health Assessment. How many of you are familiar with that? Okay, the National College Health Assessment is a survey. It's a survey that was originally developed in the United States that looks at the health of students, their perceived health, as well as what their wishes are, point of view of health promotion, and what they feel are important. And it is used in various universities, and it allows us to compare and give us essentially baselines upon which we can sort of assess where we are. So as I mentioned, this was our first year. We did the survey. Got our findings, we analyzed our findings, we were very excited about what we found, and then Paige came to see us, and she said, well, what did you find about Indigenous students in your survey? And Lina and I, who did the survey, looked at each other and said, none of them answered our questionnaire, so we don't know what we found. But we did conclude from that it was maybe important that we found out what the students wanted, the Indigenous students, and we decided to, in fact, do another project. So the demographics of Indigenous students at McGill.
So according to our registrar, we have about a little over 300 students who self-identify, and they're from all over Canada. But when we look at the numbers, we're really unclear as to how many more students have not self-declared, and maybe you have a few more thoughts about how we look at these figures, because it's an ongoing discussion on our campus, right? Students can self-identify at any point in time.
And I guess the other important note is not all of them come to our services, not all of them contact us, and so, I have a hard time understanding this data.
Right, so doing health promotion for students who don't come into the service can be a little bit challenging.
And we do know that they don't all come to the service. So defining our population
and so we wanted to just say that, I guess, how individuals define themselves. And so I am Mi'kmaq, and so people would define themselves as their nation. And then in a Canadian context, if you're talking about groups, you'll hear First Nations, Inuit, and Métis.
Can we tell us
First Nations
10
being
people from our international population what Inuit and Métis are?
Yeah, sure. So First Nations, First Nations is probably the largest group in Canada, comprising many different nations all over Canada. Inuit are the original inhabitants of the Arctic, and very brief definitions. And Métis are also have a basically European and Indigenous blended together. I think they have usually Cree, Ojibwe, and European, and so they have each of these different groups have their own culture, language, history,
French and
all of that.
Scottish.
Yeah,
Right.
I think that we're beginning to see a real resurgence of this, because people need to know that in Canada there was a great deal of shame that Métis and Indians felt for quite a number of generations of residential school. And we've seen Métis that are coming out that hadn't come out for several generations. But it's important to stress that the Métis that you're speaking about were the nation builders who married Native women. Those are what I call Métis, and their descendants, as opposed to my grandchildren who are part Carrier and part Italian German. I don't call them Métis, they don't call themselves Métis. So we must have that historical link.
sure. But some people do as well, right?
Well, I'm sorry, but I can't call them.
I understand that.
There's lukewarm and there's money coming in, and I think that is opportunistic. That's my belief. Anyway, the historical link is important because you have to recognize your ancestry and honor it. There's Métis around that don't even come to speak to me, and I could be sitting there for days as an Indian elder, and they don't even come to say hello. I've never met an Indian yet that didn't come to say hello to me. So.
And just to continue with the terminology, because you'll hear it in a Canadian context, you'll also hear Aboriginal, which groups First Nations, Inuit, and Métis, and that's in the Constitution Act. But I think, at McGill, we're using the term Indigenous a lot more. And so I think the United Nations definition is people with a long traditional occupation of a territory, but also Wilson in Research and Ceremony is inclusive of all First People, unique in their own culture, but common in their experience of colonialism and their understanding of the world. And so we are using Indigenous more at McGill, and you'll probably hear us using that during this presentation. Yeah, so consequences of colonization. So all of these different slides are from a literature review, and so consequences of colonization are racism, imposition of colonial institutions and systems, religion, residential schools, forced relocation, lifestyle disruption, and health institutions. So everything's kind of in a Western model. Everything's pretty westernized. Historical trauma, and so unresolved grief, also soul wound and intergenerational trauma are all consequences of history. And all of this also has an effect on our well-being. And so loss of self-determination, loss of self-esteem, helplessness, unresolved anger, depression, survival guilt, and health inequities. But there's also resilience. Even though this history is here, and there have been a lot of effects, intergenerational effects. The ability to do well despite adversity has been termed resilience, and attributed to specific traits or characteristics of the individual and the community. And so this is from Kermeyer, and several processes comprise resilience in Indigenous people. The Indigenous stress coping model, and so this was proposed by Walters, having an Indigenous perspective, and so advocating for the empowerment and sovereignty. And also it proposes that the associations between traumatic life stressors and adverse health outcomes are moderated by cultural factors, cultural buffers that function as buffers, so strengthening psychological and emotional health. And some of these cultural factors include, staying connected with your family and community, spirituality, traditional health practices, identity, attitudes, and enculturation. How do current Indigenous university students differ from what is described in the literature? And so a lot of the literature that we were reading were all, based in communities, and so, like based in communities, we're on reserve, and so we just asked ourselves, how do university students, or how might they differ? Because there isn't a lot of literature on Indigenous university students, and so based on their academic performances, they've made it into university. I think when we were preparing for this presentation, we were really thinking about, obviously, but not everyone thinks it's obvious, but a lot of students are coming from many different nations. We don't all fit the stereotype, varied in age range. People are coming straight from high school. Some are coming a few later after they've had a family. They vary in their residence of origin, so whether or not they're coming from a reserve or in a new community or a city. People are coming from all over the place, varied in socioeconomic classes. But these stereotypes exist, and so a lot of people will come to me saying, like, it's like there's an assumption that we're all rural and northern. I get that a lot, and so I guess this is what we kind of wanted to bring up. So we diversity exists.
Yeah, absolutely. So for those of you who don't know McGill very well, McGill is a research-intensive university, and essentially students are admitted on the sole basis of their grades, right? So our students get to McGill, and they have a 90+ something average, and that's why they're in. Now, so that means that our students are very competitive, and just like UBC students and other students across the country. So we wanted, in looking at this research and in thinking about it, we wanted to create a space for students to really come and talk to us about their stressors, right? Because they are a unique population on our campus, and we wanted to make sure that we were serving them. So essentially, we wanted to know two main things. We wanted to know what their health concerns were, and what they wanted addressed, of course, and then what educational approaches would really speak to them. We didn't want to use outdated methods, and perhaps some of the methods that were being used on campus for other students weren't appropriate, so we wanted to make those adaptations.
So the method that we used, we wanted to use an Indigenous research methodology, and the concepts behind that are that there's respect, relevance,
Reciprocity.
Thank you, and responsibility. So we decided to use a community participatory research approach, and that essentially that we would work with our community, which we identified as Indigenous students on campus, and together with them, we formed an advisory committee, and they would then help us define the research questions, define the methodology, and the ethics behind what we were doing. And all of that includes feedback back and forth. And at different points in time, we do go back to them and ask. So for example, at this point, we have posted on the website the slides that you see up until now. We do not, however, have in those slides the results of the study till now, because that hasn't been really fully approved and discussed with them, because we only have preliminary research results. And so we discussed the preliminary results, but we did not want to post without having permission to post the final and ultimate results, in the sense of following the rules of community participatory research. We used a qualitative approach. And the original thing that we wanted to do was focus group and interviews with key informants on campus. And key informants being those individuals who work with Indigenous people on campus. And the focus groups, we attempted, but we sort of learned and adapted, interestingly enough, that what happened is that if we did, by happenstance, individual interview, that we got a lot more information from the student than we did from focus groups, that there was a much greater likelihood that they would give us more information. So we switched our use of methods and decided to use much more individual interviews, and so we've done individual interviews with some of the students on campus.
With the permission of our committee, our advisory
Yeah.
group.
So it's your turn. We're going to ask you to tell us what you think the health concerns and priorities in terms of health promotion that Indigenous university students want addressed on campus.
What they want to address?
Yes.
What do they want addressed?
Yes.
Not what we want to address.
Their voice matters. Any thoughts?
I think accessibility.
Accessibility. Could you define that?
Yeah, so I'm a nurse on campus at UNBC, so I am an open door policy and I'm right across from the detention center. I also
Okay.
am a policy. And I've worked in different settings, but accessibility meaning like they can just come across, or the elder sometimes would grab me and pull me into her office, right? So, but also accessibility for those cultural activities too. We have had some focus groups, but I don't know all the results of what the students said that they wanted.
Okay.
Okay.
Any other suggestions? That's good, thank you.
Sense of belonging.
Sense of belonging.
Okay.
Sense of belonging in the community, in the university,
Yes.
in the city,
Sorry?
in the city, so in Montreal.
Well, from Brazil, I'm thinking about our indigenous people there, students there, but I think the feelings are more or less the same according to the.
Okay.
So,
Sure.
at the University of Montreal.
At the
Okay.
university,
Yeah.
okay.
Okay.
That's the other university on the other side of the mountain.
Yes.
Yes.
I think at some point there has to be like a recognition of indigenous ways of research. I've had conversations with indigenous people a couple of times now. What they say is that, well, there's a way to do things as an indigenous person that doesn't quite translate in the educational system. So that's a problem.
I should think that it would depend on how acculturated they are, whether they're urban Indians or those that just came from the reserve. Even the matter of speaking your English, the English too quickly. The matter of translation, lack of extended family, different foods, not being able to go home for hot batches and feasts, and a great deal of, I think, that loneliness, depression.
Right. Loneliness and depression, I think, are what we're
Yes.
and isolation, I guess.
So
would
there are two
be
more?
added to that.
I think probably wanting to see, it probably speaks to a sense of belonging and accessibility in terms of the governance of the university, embedding indigenization into the curriculum, into the vision, into the mission statement on a more grander scale, and then on a more micro level scale, embracing stereotypes and diversity and not having reverse racism.
Sure. And there was one more contribution?
Yeah, and just areas where, you know, yeah, Indigenous as well too, but I'm not from this nation, I know like, when we're
Sure.
at UBC, I'm at the law school and we're used to always acknowledge if there's no honest evidence of where we are, like I haven't heard yet anyone acknowledge these things, and I think it's well beyond the mission.
Yes, she did this one,
Yeah.
yes.
Yeah.
Yes.
So,
Right.
yeah, what else, but, there's areas in school where I feel like culturally safe. It's like, at least, I don't know, we're lucky at our school where we have a room that's an Indigenous lounge where we're allowed to sledge, or we can, drum. And we can also invite students, to come read and do things that aren't related to a law school, but also maybe relate to things that we're learning. And also having an Indigenous Awareness Week where we share. Like, yeah, and so if we had more people like coming up to like us law student groups and things that come up, it's growing as well too. I haven't seen it pretty yet, but
Sure.
I know that like that's what we've had, like more students coming towards us and just the law students and other Indigenous students, like I didn't know that we could do this, we could do that. And then so we branched out to other areas too. Yeah, because when I first went to my other university, I didn't know that mental was a big kind of what you could actually do and everything back with me and stuff. And yeah, I just thought it being culturally safe and having those sorts of kind of dialogue. Not everyone knows the different terms. And some people may not know, like, can I say Indian or that, but I mean, like, there is still Indian acts, and some of us are still defined by a number on the registry.
What's smudge?
Smudging is using some traditional medicines, and so I think maybe some people do it, using sweetgrass or sage or and sage, and sort of burning it and using it as like a cleanse.
You can also use cedar, and we have a fungus that grows, it's called damingillo. You can use that. So there's 4 of them. And tobacco.
Oh, tobacco. I'm the doctor in the crowd. And it is very interesting that would be a reaction that I would give, which is in fact not a very supportive reaction, isn't it? Is it? Because tobacco does have a different significance, and it is important to understand that. The other thing is, we do want to thank you for all of these things, and we did take a slide out of the presentation, which comes after we introduced ourselves, which I think would sort of emphasize the governance or indigenizing the environment in which you work. McGill, in fact, is one of the oldest universities in Canada, and it was built on land that was
Haudenosaunee
and which is Mohawk, and but what is written on our website is that it is given to us by a Scottish merchant who earned a lot of money. We never, in fact, unlike what you mentioned, acknowledge the fact that we are on, because I can never pronounce it. And in fact, all of our ceremonies are opened up with a piper.
An elder whose traditional land you're on.
We have an elder that comes to the First People's House, but that elder does not appear in any official ceremonies.
Well, we're fortunate in Vancouver that we've got, Musqueam and we've got Squamish, and so we have a choice.
We can probably have a choice as well. It's not the matter that we don't have a choice.
I like the fact that you used 2 Okinawans to open up this conference.
Yes.
We could have a choice. It's just that choice is not made. Or chosen
We're
to be
working on
made.
Okay, so for all of you who are dying to know what our students said, here's what they had to say. So we are presenting today some findings from 6 student interviews and 5 key informants. So essentially, all of the students were undergraduate, predominantly in arts programs, and only a quarter were first-generation university students. At McGill, we have a very low percentage of first-generation university students. So they're very much in line with their peers. Also, an average age of 24.3 years. Every time we show this figure, people are very surprised. They think that's very young. But that's, again, another stereotype, right? So 2/3 were female and identified as art students, and all identified as part of an Indigenous community from different backgrounds, on reserves, in urban settings, and off reserve as well. For the key informants, the majority here that were also mainly undergraduate English speaking, and the majority also were arts and female identified, and only over 1/3 were identified as part of an Indigenous community. And all were first university generation students. So it's interesting to see the split between the different populations. So in presenting the findings, our findings are really divided into 3 parts. How students identified or conceived health, the health concerns for Indigenous university students, and health promotion ideas. So I'm going to run through this quickly so that we do have an opportunity to talk through it. So essentially, when people talked about health, they talked about health as well-being that was really included many aspects of sort of the wellness wheel: physical, emotional, social, and spiritual. But interestingly, the students talked about health as having no illness, but they also talked about having balance, and they wanted to know about what access they had. So you guessed it, they really wanted to understand what their rights were. The key informants, on the other hand, talked more about the environmental factors, right? Making sure that students were prepared, having mentors, having tutors, and so on and so forth. A lot of preventative type health ideas. So when it comes to health concerns, the main findings from the interviews and focus groups so far show that students wanted to know their rights. They asked for these little cheat sheets around, how to use their band cards and so on and so forth. We heard a few really powerful stories about how students really had to track down what it meant to get a certain medication and so on and so forth, and they wanted to share that information with their peers so that no one else would have to go through that. They also wanted to understand very clearly how to access resources. They wanted information about physical disabilities, mental health, specifically anxiety, trauma, substance use, how to deal, some better coping mechanisms. They talked a lot about a few students talked about their past and having some bad coping models and wanting to move past that, and stress. But there was another issue that kept coming up over and over again, which I think some of the key informants were the ones who really brought it out in a very different way. When they talked about the environment, they were trying to subtly say that we needed to indigenize our campus and make it very different. But they talked about the university environment as and their experiences with racism, discrimination, and stereotypes. So from the key informants, the findings showed that they really wanted, as I mentioned earlier, talking a little bit more about how to adjust to university life, specific examples on mental health, specifically depression, again, very similar, trauma, suicide, substance use. They also wanted some more information about physical disabilities, learning disabilities, and then of course some of the physical and medical aspects around pre and postnatal care, sexual health, obesity, and treating diabetes. And preventing diabetes, yes. So
we want to go on to your turn again. How do you think the students want us to approach this? So which educational approach would Indigenous students suggest be appropriate to use in transmitting this information effectively? Ideas, suggestions.
Oral proofing?
Oral. Who said that? Okay, define.
I'm just learning about it myself in terms of the Western conceptualization.
Sure.
I have some ideas around the Indigenous conceptualization of the stories and the loss of stories because of where going to school and how to regain those stories back. And how does that then get honored and translated into the academic institution whereby their oral discussion is promoted through elders and people in a group setting, a talking circle, and then layered over that, how does that part of the curriculum be evaluated in terms of being recognized within the oral tradition center as well as within the academic institution center?
You're about to speak.
I don't know. I'm oral.
Yeah, there's really good models around that. One woman in particular, she's a UP professor, Paige, and she facilitates her classes in this talking circle. And she has a whole book written on it. So I'm glad you included that talking circle.
What's her name? Jane?
Fiery, F-Y-R-E -Jean, J-E-A-N, grade 1. Yeah. So, there are different.
We would say grade Lin in Quebec.
Inclusion of elders and other people from reserves that can be used as role models, other educated natives.
Which is something I found wonderful here in BC. went to, I don't know whether you know caucus, but caucus is another meeting, and I went to the pre-day, and I was totally amazed with the others that they had there, who were all very well educated with PhDs or worked in medicine, doing research, and therefore could very much relate to the students that were on campus, as well as explaining and expressing who they are and their customs.
I would just say overall relationship building. So building of relationships and building trust as a foundation for it.
Just in a really basic way, I would say, as an approach, the in-person delivery of some of this information, as opposed to look at our website. And I don't think that this is honestly specific to Indigenous students. I think it speaks to the international question there and the general issues that many students have in terms of being interacting with a large institution, which we see, I work at UC and McGill are, and how impersonal that can be. And there's the range of information that we want to convey to students is enormous, but personal relationships are seemingly valued across the board.
You raised your hand
I
this time.
did.
You didn't do the speech thing. I didn't know. I couldn't follow you anymore there.
Experiential learning, which I find funny, the academic term, which is really just hands-on. And
Sure.
a pit house was, traditional pit house was built
what?
in a traditional pit house, winter house,
Oh,
for
really?
duck health.
The things I learned with doing this
Right,
project.
so that's on land behind UNBC, and it was done for a class, and they also did a traditional dugout canoe, so having hands-on in this class.
It's wonderful. Okay, so we will share what they did say. So the students, first and foremost, wanted material that was culturally sensitive, but they wanted to be part of the part of the process. They didn't want stock photos coming from, some website somewhere. They wanted to see their own faces and then their own voices. So they included things like access band card, cheat sheets, STI information, coping with stress, mental health, social aspects, and mentoring was really important. But they also wanted to exercise together. Lacrosse came up many times. And the key informants, they talked about, education around medication, academic supports, and prevention, specifically around nutrition and exercise. I find this last slide here around the dissemination, how they wanted the information conveyed to them, really powerful. Again, they wanted it to be developed with or by Indigenous students or staff. They didn't want it all at orientation. I know it's really hard as we prepare for September. They didn't want to get it all in one spot. But what was fascinating was that they wanted the methods. They wanted workshops, right, in person. But they also wanted a few pamphlets for information around like the cheat sheets and access and what have you. Emails were fine, but not only if necessary, right? We inundate our students with too much. They also wanted tabling. They wanted to ensure that students who weren't coming to the First People's House also had access to this information by going into the community. And last but not least, they also wanted some social media. Some of the older students didn't really care very much about social media, but the younger students did, which I think reflects, sorry, yes?
What is tabling?
Sorry? Tabling? Oh,
Taking a table and doing a display.
right, going out into the libraries
Actually,
and
it means
classrooms.
going out into the community.
That's right.
So, I mean,
So,
one
yes.
very salient example of that is that our
thank
Faculty of
you.
Education is essentially half a block from the First People's House, up the hill. We're on the hill. And the students who go to the education faculty are a lot of students who are Inuit. And they don't come down to the First People's House. So if we want to help them with some of their issues, we will need to go up to them.
Right.
So that's what was suggested and was talked about. But also it was an opportunity for those people who didn't strongly identify or who did not understand or who felt maybe a little bit anxious about the traditional methods because they had not integrated them, they were foreign to them. There was an opportunity for them to also be able to, just as part of the crowd, kind of go in there and find out.
So just a question on, like, when we're looking at what information they wanted, how they wanted to send it. Did they want, specific indigenized materials developed? Or did they just want access to some, like what?
A lot of them actually said that it was hard to, like when we asked what does culturally appropriate or
Yeah.
culturally welcoming mean to you, a lot of them said that it needs to be diverse because everyone's kind of coming from different cultures. There's not like a one size fits all type
Yeah.
thing.
Yes.
And so it could have been like, I don't know, as long as you kind of vary it. And a lot of them were just like, as long as it's delivered by Indigenous students, then maybe that would be the way to go.
A very important first step. So we had a lot of key learning moments. Would you like to start with your first one?
Yeah, well, I remember when we were first going over the results, I think mine were the differences between what students thought the issues were in their approaches and what the staff thought it was. I think the differences, was my learning.
Mine was essentially, as a physician, I expected a lot of medical issues to come up, and yet it wasn't that. It was a lot more about communicating, interacting, and accessibility. So it wasn't about STIs, and I was just very disappointed by that.
And for me, essentially, it was how open and honest they were. They preferred to have the one-on-one interviews. They wanted to share, they wanted to tell their stories, and they wanted to ensure that the information was going to be reach as many Indigenous students on our campus as possible. So, questions? Yes.
Some of them. It
Yeah.
was
Some of
about,
them.
it wasn't all.
Yeah.
It wasn't all, it was varied. It was the people who worked either in one-on-one with students or with large groups of students to assist them when they were on campus in a variety of ways. So they have different backgrounds and jobs.
Yes.
You mentioned that discrimination was one of the issues that came up. So how did they want that to be addressed?
They talked a lot about training and workshops for staff, building on Indigenous Awareness Week. And training came up.
Yes, and we have some, we didn't have a chance to go through the quotes. We had to condense our presentation, but we do have some quotes from students and from key informants up if you wanted to have a look. And the discrimination one here comes up a lot. I think the fact that we're often non-visible minorities, so non-white minorities, we have issues with racism and more stress and mental health in the university setting as opposed to white students, and it makes us more uncomfortable to access services. So this is
There was a lot of suggestion about
Yeah.
training
right.
the people who work
Yeah.
with the students
Yeah.
in
In different
variety
capacities,
of
yes.
capacities.
Yeah. And some training for peers as well,
Yes.
right? To debunk some of those stereotypes and myths. Yes.
You mentioned Indigenous research methodology. I'm wondering if you actually developed an Indigenous framework for the research?
No, we used the Indigenous framework that was developed by the people in Kanawaki. They have a very strong research group within Kanawaki that works both with McGill and Queen's University and have done a variety of studies, primarily around diabetes, but other health issues. And they have developed a model that we have gotten the permission to adapt. And in fact, this was done, the adaptation was done with the help of our advisory group, because we took the original model, got their permission, and then we sent it out to them and we said, okay, there's some questions here we want, there's some things that are very specific to this community. Is this something that would be acceptable to all of you? So for example, at the beginning of any session, they talk about doing cleansing ceremony. And we said, well, is this something that would be acceptable to other people who were not from the Mohawk Nation? And the compromise that was interesting, because it was a compromise that was made, was in fact that, yes, maybe it would be, but what we needed to do was to ask first. Is this something that you want to do or want to participate in? So we went through all of the issues and the items in the ethics and research methodology that was developed by them. We felt, why reinvent the wheel when it was so wonderfully done?
Is that a group? Can you spell that or like? I'm not sure if you can, but.
I know I can't. Yes.
I think getting back to this woman's question over there that had to do with the framework, I think the most important thing is consultation. And I believe that the community has to identify the issue that needs to be researched.
Right.
When I was working at BC Women's Hospital, we kept on getting reports and it kept on coming back to the hospital about this particular reserve situated amongst other reserves that had a rare genetic disposition to the long QT syndrome. And it took many, many, many visits between our genetics department at the hospital and the community before they engaged in any kind of study. So I think that's the most important.
Yes, that is very important. And we identified what we wanted to study, but what we did do is then go to the group and to the students and say, this is what we want to do. Do you want to do you think this is a good idea? Do you want to participate? Do you think we would be helpful? So we did that at every step. We thought it was really important to do.
And there was just one last comment at the back. Yes?
Yeah, and that was more of a methodology question around ethics and how, and I really honor and like the way that you approach your research, the grassroots, participatory, community-based research, and having an advisory committee. I get the sense that knowledge translation was planned from the outset, that everyone is beautifully done. So I really want to honor that on the one hand, and on the other hand, I think about, I wonder how it went through ethics and how that was pursued. Did you have any problems getting it through ethics?
No.
So were they
We
struggling
in fact went
with
to
the-
expedited. We were
Right.
expedited.
Because there was a history of working with that framework,
Yes.
right? So,
There was a history of working with that framework at McGill, first of all.
yes.
But more importantly, it felt that, and it may reflect the composition of the ethics committee, that it would not be harmful,
Right.
that the subject matter was not something that was harmful.
Is that an under orientation weeks at all, or do you want to see more of it in orientation?
We haven't worked with developing anything at this point. We're truly
Still at the
gathering
research stage,
information.
yes.
And where that will be, again, will depend on the students and our advisory committee and how they want us to do specifically. And that's our next step.
I did a study at McGill, and it was all from McGill students. It was also a qualitative research study on microaggressions, students' experiences with microaggressions on campus, which is like micro insults, like discrimination,
Right.
basically.
Yeah.
Well, like what happened to us in the cab last night.
Yes, exactly. So
Yeah.
there's that, and like there's a lot of recommendations coming from that. So I think that we have some things to work from, but I think we have yet to like really roll something out on campus.
Right.
But yeah.
We had a lovely cab driver last night, but it was really interesting. He started to talk to us about how he worked in Quebec and it was really cold, and how this Cree Indian woman would come in and chop his wood. And so I went over to Paige and I said, "Do you chop wood?"
Sorry, just one last comment, yes?
I just wanted to say, as a group of people who work with Indigenous students, I think at some point it might be important to find a way to make Indigenous students sort of discuss more with people who are not Indigenous. Myself, I am clearly not Indigenous. I'm African. I have this fascination about the history and all that, but I find it difficult to get that level of engagement. So there's a form of enclosure, among Indigenous students. So I think at some point it might be good to have some neutral kind of perspective, or someone who doesn't know anything about Indigenous people, the history and all that, coming into research and just doing some work straight up. But you can't do that as someone who's not Indigenous. I think that's a problem.
We do have someone on campus who his role is to do Indigenous education on campus. So he does the Indigenous Awareness Week, which is for the entire McGill community to learn about various aspects of Indigenous history and culture and realities. And a lot of his programming is a lot based on like non-Indigenous people learning more about Indigenous culture and trying to do more of that inclusion. So, but yeah, I understand that it's not easy and it's a challenge, and that needs to be acknowledged too. Yeah, for sure.
The Indigenous Foundation website at UBC, which is a great website to go to learn, and it's also important to notice that as non-Indigenous individuals, it's hard to